A recovering anorexic said, "There is no magic cure, no making it all go away forever. There are only small steps upward, an easier day, an unexpected laugh, and a mirror that no longer matters." Have you ever looked in the mirror at the beginning of your day and seen an image that no one else saw? An image that only you personally see. An image that looks much bigger than what it really is. I have learned a great deal about anorexia in the past couple of years. It is a disease that unfortunately is becoming more and more popular in our generation. It is on television, movies, and magazines, and something that I have seen with my own eyes when my cousin suffered greatly from this terrible illness. Our society needs to become more informed on the mental and physical effects of anorexia. Anorexia is a tense fear of becoming obese, which does not diminish as weight loss progresses. It is a disturbance of body image, for example, claiming to feel fat even when one is very, very thin. The term anorexia nerviosa means a nervous loss of appetite. The failure to eat goes hand in hand with other behavioral changes. Those suffering from the condition become preoccupied with food and adapt ritual practices concerning eating. An important cause of anorexia is the existence of stressful events in one's life. It is usually when you feel stressed and worried, when you are working under pressure, or it is common that you suffer nervousness as a consequence of life changes. These situations begin to affect your schedule, and you stop doing vital activities to stay healthy. In the case of anorexia, a person begins to skip meals during these times or stops eating at all. Anorexia is increasingly common, especially among young women, but is also affecting a growing number of men as well, particularly those of athletes. Anorexia affects teens as many as 3 in 100. After understanding exactly what anorexia is, it is helpful to be aware of the mental and physical impacts it can result in. The disordered perception of self, inability to remember things, refusing to acknowledge the problem, and becoming obsessive with food are all factors that can affect one mentally. Depression and eating disorders go hand in hand together. Together, the two rob a person of their happiness and self-worth. Those with eating disorders tend to range from mild to severe depression. Men and women use their disorders as a way to hide from oneself. According to Stephanie Dugloff, the author of the article Eating in Peace, said, "Mostly, although I didn't realize it at the time, my eating disorder was a way of trying to suppress any emotion." The biggest physical effect for women suffering with anorexia is not being able to produce children. Also, the hair on one's head can become thin and fall out, but there can also be an increase in body hair as well. Blood pressure can drop due to inadequate body level fluids, causing episodes of fainting and feeling dizzy. Our bodies are inevitably the most important gift we own. With the information I provided, it should help people be aware of what an eating disorder is and the struggles both physically and mentally your body could potentially deal with. Anorexia is a serious disease in which 7 million across America deal with daily. However, it can be beat. Helen Keller said, "Although the world is full of suffering, it is also full of overcoming it."